I work in the Great Kite Clinics, which is just outside East London in the old, possibly Siskai area. I've been working in the clinics since 2008, and before that I worked at Mussolini Hospital, which is in Umkanyagudi district in northern KwaZulu-Natal, and I was there for 10 years. And part of the reason I think for coming to the clinics is that at the Mussolini Hospital I really got to understand more about clinics and primary healthcare and working in the community, and that's really what I wanted to do. I think the rural doctor, you have to be possibly more of a generalist because you don't have as easy referral patterns and patients aren't as close to referral centres. So whereas in a rural area you've got to be sometimes quite creative in trying to decide which are the best blood tests or investigations to do, and then how is the best way to get the patient back, and then what are you going to do with those results. So how are you going to refer the patient so that they don't unnecessarily travel back either to the clinic or travel all the way into a town, to a big hospital where perhaps it's not totally necessary. And you have to have a good maybe an interest in working with the community. So you need to be able to liaise with community health workers, be able to see where a patient lives, want to go and understand the environment that they come from, so that you can understand sometimes what's influencing patient, why they're not taking treatment, or some of their beliefs, some of the poor circumstances that they come from. I think I get my inspiration from my faith, from God, and my belief in wanting to help people, and more than just giving out pills for every ill. I think in the rural areas you have amazing people, and it's hard to connect and see each clinic as a team. I think learn to listen to your patients and be prepared to learn from them and connect in with other people as well. Have a team approach.
I work in Ceres Hospital in the Western Cape. It's the Cape Winelands district, the Witzenberg sub-district. I've been there since May of 2006. I arrived in the winter, and it's now been 8.5 years. The rural setting is very different obviously from the metro, in the sense that I think that's what my community service doctors experience most. You're the final frontier for most patients. I mean, you have to sort out the problem. When you're on call, it's only you. So knowledge and skills wise, you need a wide range of skills. So what we see in the rural setting is very diverse. You cover the full range of medicine, of all the different departments are wrapped in one. And you have to be able to handle all those different situations that come your way. I think the very interesting part is outside the hospital. You're working with a community also, so that the patient isn't. I think in the metro you tend to think of a patient, you treat, you send him home. You're not really involved in the community. When you're a rural doctor, you live in the community, and you start thinking community, and you start seeing where the problems are, and you start thinking after a while and getting ideas of how to possibly solve problems. This award is, to me, I think in a sense, recognition, which it's obviously nice to have. But I grew up with the idea imprinted that your life must make a difference, and in this award, I get the feeling that I've probably made a little difference up to now, and that's inspiring in the sense that it challenges you to do more.
Hi, I am an occupational therapist working at Mangozi Hospital. Mangozi Hospital is in KZN, far north, right on the border of Mozambique. I've worked there for 15 years as an occupational therapist. Then I moved to Umkanyagudi Health District, where I became the first rehab services coordinator for the whole district. My job entails managing the therapy department that is made up of 4 categories of therapies, like it's occupational therapy, physiotherapy, speech and language and audiology. In rural areas, that's why we don't consider professional boundaries much. Like if a person comes to me and the physio is not there, I'll do a bit, and I won't turn the patient away. If the social worker is not there, I'll have to do something, because this person has traveled kilometers on foot or has paid quite a lot of money to get to a hospital or a clinic. So that's where the difference is. The accessibility of health services in a rural setting is more challenging than in an urban area. You have to be sensitive to the needs of the patient and the effort that they've made to present themselves in a health facility. I've been there at Manguzi for a long time. I've got to know the community and the clients, patients very well. And I enjoy seeing people appreciating our service. The smile that the person has stays with me, and I try by all means to find happiness in what I'm doing and cling to it. I think this is once in a lifetime for me. And maybe it says all those years, there have been frustrations working in a rural area with no resources. You have to rack your brains, come up with a solution. So the achievement of this award is like a handkerchief wiping all the sweat of the years of frustration, and I will appreciate it forever.